our hope is to bring world-class US-based surgical techniques to the world. Indeed, to bring some of the leading minds and the leading surgical technicians that are the developers in minimally invasive spinal surgery, doing new techniques and motion preservation, and bringing them from outside the United States to the world so they can share our knowledge and our techniques that we've been able to develop over the years. Spinal surgery has come an incredibly long ways in the past 20 years. As an example, when I did my training many years ago back at Georgetown University Hospital, we were one of the first neurosurgical training programs to do complex spine surgery during our residency. For us to treat a simple, complex problem, a single level lumbar fusion, it would be a 10 or 12 hour operation. Patients were staying in the hospital 2, 3, 4 weeks at a time. Really overwhelming complications with infections, lung problems, blood clots, all sorts of horrible complications. And what patients were remembering is that it would take them 1, 2, 3 years to recover from the surgery. They couldn't even remember what the problem was that they came in for the surgery in the first place. And over the years, we found that by sort of minimizing our surgical footprint in the patients, by being able to go and take care of the pathology without ripping apart the normal tissue, to truly do not deconstructive surgery, but reconstructive surgery, I'm now able to do more complicated procedures and do them in much less time. So patients are actually going home now, having their surgery, going home and eating lunch in their own house in a more efficient manner than I used to actually be able to do the surgeries 20 years ago. So now where patients historically would come to our surgeon's office and say, "Doctor, I know that I heard you're telling me I need spinal surgery, but my family members, my friends tell me I shouldn't have spinal surgery until I can't walk." And that's what we hear over and over again. We're doing something different now because now most patients who are being referred to my office are being referred by patients that have had these surgeries. So we're doing something different, better for patients now. We're finding that there's a strong need for the US patient to go abroad. Why would that be? We certainly think that we have some of the best trained surgeons in the world, great hospital systems, great technologies, but what's happening is because of governmental interference, insurance companies deciding what can be done and what can't be done, 30% of the time, I cannot give my patient what I think their best care and treatment is because I'm told, oh, that costs too much, or you know, that we don't think your patient should have this, they're too old. And so that relationship, that really sacred relationship between the patient and the physician is being interrupted in the United States. And by going internationally, what we're finding, we can now be back in control of that relationship. And between the patient and their surgeon, they can decide what's best for them instead of someone else telling them what's best for them. And by doing that, we're getting rid of the middleman. So we're not having these middlemen telling us what to do. And there's a huge cost savings in that alone. By using these minimally invasive techniques where patients don't have to be in the hospital 2, 3, 4, 5 days, 7 days, by having patients sometimes go home the same day of their surgery, there's huge cost savings in that. And then for patients, they can then recover on a beautiful island in the middle of the Mediterranean. Absolutely, many U.S. citizens don't have any idea where Cyprus is. So again, a beautiful island. English is a spoken business language. That they have beautiful hotels, beautiful beaches, friendly people, and they've got a very good medical infrastructure. They don't have all the sophistication of some of the bells and whistles, some of the more modern minimally invasive technology, but it's something we're going to go there and we're hopefully going to help train the local surgeons as well. It's really a platform, it's really a team approach. This is something where the surgeon may be the captain of the ship, he can't do it by himself. And we really need a team approach. We need to have surgical technicians, surgical nurses who are familiar with these procedures. It's certainly our increased knowledge of the anatomy, the structural elements of the spine, how the biomechanics work. It's in knowing how different retractors can work through the tissue, dilating through tissue instead of cutting through tissue. Using different types of implants of different types of materials, having real-time surgeon-controlled monitoring of the nervous structure so we know what we're doing to the nerves as we move them around. Having real-time x-ray visualization in the operating room. All these things really add to our ability to do things that we would have a difficult time doing in the past. As well as we certainly partner with biomedical companies that are also that some of the key surgeons in this program, AIMIS program, have worked with to develop some of these newer products. There's always going to be a role for open surgical procedures for certain kind of conditions. But part of the problem is that what we're finding is that our standard procedures that we do, that we actually destroy a lot of normal tissues to get to the pathologic tissue, to get to the part that's hurting the patient. And those tissues that we're destroying, God put them there for a reason. They're very important in the structural integrity of the spine and how the biomechanics and how the patient moves and how it protects the underlying nerves. When we can get in there and take care of that pathology without ripping apart that normal tissue, is there benefit to the patient? I think it's quite obvious that there would be. It's not just that it's a smaller incision, which they certainly tend to be, but there's less tissue destruction. We always hear about with global warming, talking about carbon footprint. Well, I think that the minimally invasive surgery, what that truly is going and taking care of the patient's problem, whatever it may be, and taking care of it and doing it in a valid way, but reducing my surgical footprint inside the patient. That's the beauty of minimally invasive spinal surgery. Earlier this year, one of our major spine journals is putting out a special edition on minimally invasive spine surgery. I and 10 other surgeons were invited to contribute to this. We spent several hours one Saturday morning in Chicago trying to define what minimally invasive spinal surgery is. It's not a very easy thing to do, and again, I think that it's not the size of the incision, because sometimes we do great big operations with minimally invasive techniques. It's really going and taking care of the problem and minimizing the trauma that I do to the patient. All the surgeons that are part of AIMIS have been vetted by myself and other members on our team. They're surgeons I've known for years. They're surgeons that I've either seen in the operating room or have talked to people who've been in the operating room with them. Our collaborative experience of AIMIS, the surgeons who are involved with AIMIS, we really have the largest collaborative experience in the world in just about any type of spinal surgery you can think of. Minimally invasive techniques, motion preservation techniques, cervical fusions, microdiscectomies, just about any procedure you can think of, we probably have the largest single experience cumulatively in the world, which is really quite remarkable to be able to say that and say that honestly. As well as the fact that the majority of the members of AIMIS are already, again, pioneers in trying to find what's the next best thing in spinal surgery, because we know while we're making great strides, doing marvelous things, we always know that there's got to be something better out there for our patients, because we're never satisfied. We want to always push and find what can achieve a slightly better outcome with less stress on the patient. I would think that within the next 5 to 10 years, our plan would be to have 3 to 4 functional centers around the world. And we're certainly looking at places where, one, we need to have the surgeons that are the quality that can man these centers. Second, we want to go in a place where it has a place where a tourist would like to go to vacation. I think that's another important part of it. Third thing, it has to have a local medical community that's going to want to partner with us. We certainly don't want to go into a community, become the big, bad, ugly Americans. We want to work with the local medical community and to have a partnership. I think that's very, very important. As well as obviously have a stable government that again, we can work with and be comfortable with. AIMIS, to me, is something we've been working on for really 5 to 10 years to put this together. And again, I think we have just wonderful surgeons, which is an important part of what we do. I've been to some medical tourism organization groups where they had some wonderful speakers touting the wonderful care in India and Thailand, the Middle East, which it is. And they were speaking of what a beautiful hospital it is, what a great MRI they have here, and this is why they should come. I think that spinal surgery, if you don't have a good surgeon, you're really behind the 8 ball to start out with. So I think that the fact that we have really quality surgeons, world-class surgeons, really sets us apart from any other medical tourism project out there. That the strength of our program is our surgeons, and the fact that we're dedicated to giving the highest quality of care we can possibly to our patients.